And today we're starting off some new topics. Very soon, open enrollment begins for Medicare. So are you ready? Well, the experts at Independent Health are here to help. We welcome Laryssa Domagala back with some really helpful information. Laryssa, nice to have you here.
Nice to see you again. Thank you for having us.
All right, Laryssa, who needs to pay attention to open enrollment?
I think it's important for everyone to be conscious of the timelines and the information they're receiving. Pretty much Medicare open enrollment for most beneficiaries starts, we can start talking about plan information October 1st, but really October 15th through December 7th is really the window that people should be looking at their plan, looking at the information they're getting, and making a decision for January for the next year.
If someone is completely happy with what they have, do they need to make any changes?
They typically do not, but what we really encourage people to do every year is review the information that they have, make sure that they understand, and call your plan or stop in just to make sure there's nothing that they need to do additionally. A five-minute call or a 10-minute stop in could save a lot of hassle in the future, so we absolutely encourage that.
Because things can change for you.
Absolutely.
And then you say, gee, I want to make sure I'm covered for this because I know, as you're getting older, this could happen. All right, so how can someone prepare to come in to see you? That
is such a great question, and this is what we would tell anyone really looking for insurance or plans for the next year. Kind of understand where you are in your life. Do you have any new medical changes? Do you have new providers or doctors that you're seeing, new prescriptions? Are you starting to spend a little bit more time out of the area? What's changed in your life specific to you? Have that kind of written down, have your medications written down, your new providers, and have that ready. So when you're talking to your insurer, they're answering the questions that are important to you.
Plus, there are some changes that perhaps will impact all Medicare beneficiaries in 2019?
Correct. So everyone on Medicare is getting a brand new Medicare card. So most people in New York should have received this by now, but keep your eye out. It's going to look similar to your traditional red, white, and blue Medicare card, but they're no longer using the Social Security number for privacy and safety concerns. So we want to make sure that you've received your new card. Your old card will be good for about a year, so if you haven't received it yet, you're still okay, but keep an eye out for that. Also, there have been changes with the coverage for the Medicare Part D, the coverage gap or the donut hole. They're getting, Medicare beneficiaries are getting a little bit more coverage in the donut hole, specifically for their brand name medicines. So that should hopefully save Medicare beneficiaries some money next year.
That is great.
Yeah, so it's important for everyone to kind of know what the changes are.
Now, if you have questions, how can people get their questions answered? You probably recognize Laryssa from the commercials. I think that's a clue.
We encourage, we are very fortunate. We have Medicare information centers in the community, so we are very fortunate. We look forward to seeing our members face to face every year. But you can stop in, call, check the website. Those are all great ways to get information about your coverage or your choices for next year.
And how much time are they going to spend with you?
As much time as they need. If someone just wants to call in and they reviewed the information, I was just talking to one of our representatives. They said, oh, we got the information, thank you so much, and we're good. And so we're happy with that too.
So here's the information for you at home. You can call either of those two numbers. We even have a TTY user's number, or please log on to independenthealth.com/Medicare.